You and I know that in Nigeria, over the last 5 or 6 years, there have been multiple extreme weather events that have contributed to flooding in many parts of the country. With each of those flooding episodes came an increase in incidents or cases of malaria that were happening, with even some laboratory studies showing that with a rising temperature, right, some of the insecticides that we have now will not be as effective. So that's a whole changing landscape of things. Post-flooding came an increase in outbreaks like cholera and meningitis. During the flooding itself, there were disruptions to health service delivery. So fewer kids got vaccinated, fewer women got delivered by skilled bed attendants, fewer people went to antenatal care. We're already feeling the effects in real time on the ground. So whilst you can have a debate all day about who's the more responsible person for climate change, I think that the focus from the perspective of someone from a low middle income country like Nigeria is how is my country best positioned to adapt to the extreme events that will follow a changing climate.
Hi guys, Nigerian H has evolved over the years from a health intelligence platform that was founded in 2007 to becoming a trusted advocacy partner supporting development programs across Africa. You see, as we mark 10 years of driving policy conversations at the Future of Health conference and convening decision makers and health experts across the world, we'll be discussing one of the most critical global health issues of our time, and that's the intersection of climate change and health. And why now? Nigeria is expected to become the third most populous country by 2050. This means that climate change threatens to worsen our health inequalities as we know it, thereby affecting our overall health system, our environment, and the way we live. To break all this down, we're super excited to announce the launch of our Climate Conversation series, where we'll be discussing with leading experts at the forefront of addressing the climate and health crisis. So be part of the conversation by tuning into this podcast series or joining us on the 23rd and 24th of October 2024 at this special 10th edition of the Future of Health conference, where we'll be discussing sustainable solutions to address the impact of climate change on health. See you there. Dr. Chijioke Kaduru has over 15 years of experience really working in multiple geographies. You've implemented various health initiatives, designed programs to improve the health system, to build resilient health system, and your insights are particularly very helpful or useful now, and given that we're discussing the context of building resilient systems for climate change.
Yeah, thank you very much, Emeka, and it's a pleasure joining you on the show. And I'm definitely looking forward to this Future of Health conference, particularly because of how topical the issue that it addresses is. Talking about myself can sometimes be difficult, but I'm a physician. I work in public health, been working in public health for over 15 years across multiple sides of public health, both from implementing at field level in communities, in districts or local government areas, as the case may be, to supporting leadership decision-making at the very highest levels, depending on what the context is. I think that for me, the catchphrase is really around understanding what needs to be different in our health systems and in how our health systems operate. I think that what we are fundamentally missing as a low middle income country or a country that is sat in sub-Saharan Africa is that we're dealing with a lot of preventable deaths that are happening among the youngest people and among the poorest populations as well. And until we are able to build health systems that cater to all of the people within a country equitably, we're ultimately going to leave people behind. And there shouldn't be any efforts that are targeted at improving our health system that is ultimately going to leave someone behind. And so if we turn our focus to the things that are preventable, but at the same time that target some of the hardest to reach, furthest to reach, and poorest populations, then we might actually build a fairer and more equitable world through the work we do in health. I think that's, for me, really the guiding philosophy across all of that. And so whether the work we're doing is in providing technical assistance, or it's in doing research, or it's in testing innovations, as the case may be, I think that when we remember why we do it and when our focus is really on those populations that it serves, then we're sort of able to bring different experiences to bear and do the work the best way that we can, as the case is.
Yeah, I mean that's actually very interesting, and I think what you say just resonates with that catchy phrase as well. you're as strong as your weakest link. Basically, you can leave no man behind. There's focus on global health programming around ensuring vulnerable populations that we're catered to. And it's interesting in the context of the conversation we're having now on climate change, how countries like Nigeria and Africa were the most vulnerable, but we are not among the biggest contributors to carbon emission and climate change, if I'm to say, right? Does that give us a lesser responsibility, or means that, or how do we capture the narrative whereby we are willing to contribute or help address this crisis? Some people have more responsibility in this.
Yeah, so I think that maybe the conversation around who's responsible or more responsible or not for industrialization and ultimately its contributions to carbon emissions and climate change, I think that sometimes it's a bit of a misplaced conversation. I think that the focus on whether or not, as someone from an African country, my country has strongly contributed to a change in climate, I don't think that needs to be the focus for us. I think that what we have to come to terms with is the fact that the brunt of climate events will be borne mostly by women, by children, and by the poorest populations. And we contribute quite significantly to those populations. So whilst you can have a debate all day about who's the more responsible person for climate change, I think that the focus from the perspective of someone from a low middle income country like Nigeria is, how is my country best positioned to adapt to the extreme events that will follow a changing climate? And I think that that's what we need to center the conversation on. I think that if we center the conversation on that and center our engagements with the wider global community around that, then we're better able to identify opportunities, mobilize resources, and put in place very key interventions that ultimately help make sure that when the shocks come, our system is better able to respond. Whilst we may not have data about the significance of the impact that we're feeling right now, I think it's important to recognize that we're already living with climate change and its effects, right? And the moment we recognize that, then we have to come to terms with the fact that people are already suffering the consequences, right? Yeah. And in the context of a changing climate, one of the more tangible ways that we feel it is in extreme weather events. And you and I know that in Nigeria, over the last 5 or 6 years, there have been multiple extreme weather events that have contributed to flooding in many parts of the country. With each of those flooding episodes came an increase in incidents or cases of malaria that were happening. Post-flooding came an increase in outbreaks like cholera and meningitis. During the flooding itself, there were disruptions to health service delivery. So fewer kids got vaccinated, fewer women got delivered by skilled bed attendants, fewer people went to antenatal care. We're already feeling the effects in real time on the ground. So we have to change the conversation. We need to focus on what are we going to do about these realities that are in front of us? How do we find the resources to ensure that a system that is already weak, that needs strengthening, is also in a position that when the shocks come, it can actually respond to the shocks? And at the moment, I don't feel like we're having enough of these conversations.
Yeah, absolutely. Because what you've said just touched upon, the need to take responsibility. And during the COVID-19 pandemic, we saw how it was re-echoed, the whole of society approach, right? And this, there are many parts to this. There's a part that, reminding us how we are mostly reactive, right? And it's not just a Nigerian thing. We saw with the 2014 Ebola outbreak, we rose to respond. Everybody sort of like remembered what hand sanitizers, the role of hand sanitizers, right? Mm-hmm. And some people even died from saltwater baths. I often think with climate change, what needs to happen to be that wake-up call, right? To get us back on our feet, to get everybody taking responsibility of being aware of how they should take responsibility, right, to address this crisis.
So, I mean, in context, right, I would say that there are a lot of things that are happening, right, across different agencies of government, different private sector entities, different multilateral organizations as well. And ultimately, all of these things at some point converge towards helping us sort of adapt to climate effects, right? But we, as a country, have consistently demonstrated the ability to silo every conversation. And so everyone is working in a very niche pocket, and they're then only able to have a very small effect on the results. So colleagues at NIMET will tell you that, well, they've shared meteorological projections about what changing rainfall patterns are going to be, both in terms of the timing, but also the amplitude of the rainfalls. We're already anticipating that there will be floods across a number of states over the coming months. Whether those floods are from opening of dams, dams and overflowing riverbanks, or those that are being driven by floods or by rainfall as an extreme weather event that is then superimposed on an already raised riverbed, as the case may be. Those projections have been put out. But then how well are other agencies of government who are working in other aspects that need to help respond to that reality? How well are we engaging on those conversations, right? If you think at the subnational level, think about all the states in the Niger Delta, right, where there's already a clear risk that we're anticipating an extreme weather event. What are they putting in place today to ensure that when there is a disruption to the health service, we're still able to provide a service? Whether it is moving a health facility and its service provision away from the permanent structure to a temporary fixed site somewhere that is at a higher plane that ultimately makes sure that you can still deliver services. Whether it's about rethinking how you're enumerating your community members that should be benefiting from a specific service, right? Whether it's around, for example, name baseline listing of children who are due for vaccination. Knowing that if those kids miss their vaccine shots over the next 3 months, then they are higher risk of vaccine preventable diseases. But these things can happen at a subnational level in LGAs, in states, in response to the communication from NIMET, working with NIMET and understanding the data that NIMET has shared. All right. But how often do you see that movement or those conversations? We will always wait and say, well, God will protect us and then nothing is going to happen. But then when it happens, we're now stuck in response mode, right? So when we try to think about what needs to happen differently, it's really just more people talking to each other and people providing leadership for that to happen. If we get more cross-sectoral collaborations and conversations around extreme weather events that are, again, a part of the bouquet of a changing climate and how those impact on health services, whether directly or indirectly, and start to think through from a planning perspective, whether strategically or operationally, how do we get ourselves ready, right, to make sure that when this comes, and sometimes it now feels a bit inevitable. So when it comes, and if it's inevitable that it will come, how are we making sure that women and children are not cut off of services that they need, that are life-changing or life-saving, as the case may be? So I think that for me, that would really be centering the conversation is how do we provide leadership for stronger collaboration between the different entities that need to be a part of the conversation if we'll be able to deliver adaptation and mitigation strategies for climate change.
Strong communication, strong collaboration, intersectoral collaborations, very, very key. And bringing us back to your outlook for the, conversation we're about to have next month at the Future of Health Conference. How do you see these conversations taking center stage in Nigeria, and where do you see us now? Yes, it's a conversation that needs to happen. The conference is quite timely, but do you think we are ready? Do you think these key entities that you've mentioned are ready to really take the step in the direction to move the needle? And I'm ready to do things differently, really. I know it's
I mean, realistically, right? It's difficult to decide whether or not people are ready, because the realities are that if you have to think about maybe not just the COVID response, but all of what we've done in health security in Nigeria over the last few years, responding to different outbreaks on the go routinely, whilst also trying to essentially build the system at the same time. So essentially it's us working through, you're in the middle of a fire, your building is burning, it's on fire. You're still trying to build and trying to quench the fire at the same time. So I don't know that there's going to ever be like some touch point or 0 point where everyone says, well, now we're ready to do the hard work, right? The hard work starts from even having the conversations, right? And that for me is why, again, the theme of this Future of Health Conference is really timely, right? It's forcing the hand of everyone who is a stakeholder in this piece to get together and start to engage and talk through what is possible and what some of the realities are, right? I think that there are many aspects of, the evolving conversations on climate change that Nigeria needs to think much more critically about, and that we need to bring center stage to the conversations, right? Whether it's around how we tap into global climate financing facilities and ultimately mobilize resources to help us build health and community resilience across our systems, whether that's the option, and that's an option. Whether it's finding ways to catalyze innovation among a very large population of young people who are deploying all kinds of digital and overall social and business innovation to solve problems. How do we catalyze those innovators to help deliver solutions that both mitigate and help us adapt to climate change, right? In the context of the health system. Again, these are opportunities or conversations that can be triggered because we're having a convening, right? And thank you to Nigeria Health for providing that leadership over the last 10 years to have these instrumental conversations. But I think that when we start having the conversations, we almost essentially force everyone's hand, right? I think a lot of the conversations that we've been having, even in mobilizing resources to strengthen primary healthcare, are about building an epidemic-ready primary healthcare center, right? And that sort of being part of the mantra of the conversation. But even being epidemic ready as a primary healthcare, center might not necessarily translate into being climate ready or climate resilient in that sense, right? And so it's about broadening the conversation because we then are able to mobilize more resources to support those interventions as well. But the conversation for me that starts with the Future of Health conference is a good trigger that ultimately gets us going around all of what is going to be possible as we go through the next few years dealing with climate events and understanding how they ultimately will shape up our investments in our health system.
Yeah, you've really just spoken about where we are right now, and I'm quite keen on moving to how you're working to prepare for the future through your through your malaria modeling fellowship. However, in your fellowship, implemented by your organization, Corona Management System. And kudos to Corona Management Systems, actually. You guys are doing very, very great. It's a very innovative project. You're the principal investigator, so we're really, really, really lucky to have you here to speak to it, actually. And not just building our capacity to respond to malaria, but also the fact that it applies to other diseases as well, building that local capacity, individual and institutional. Right? How does that really help us, or how are you using that to sort of contribute to strengthening our health system to be more climate resilient?
Right. So I think that it's always helpful to sort of set the stage, right, around the drivers of some of these interventions, right, as to why they were choice interventions and why they made sense or they mattered, right? Nigeria's contribution to the global burden of malaria is not a hidden piece of information or not something that everyone doesn't know as a stakeholder in the malaria space. There's also country recognition of that contribution and the challenge that it poses. I think that one of the things that the Honorable Minister for Health and Social Welfare has particularly sort of provided leadership for was the Malaria Ministerial Summit that happened, which was a very important high-level convening that showed a clear appreciation of the problem of malaria and our contribution to the global burden as is. So as a country, we already recognize that this is a problem and we're a big driver of that problem, right? Now, the context of the Malaria Modeling Fellowship, and maybe it's also important to highlight that fellowship is led by the National Malaria Elimination Program and co-chaired by the Nigeria Center for Disease Control, working with the WHO, the World Health Organization's country office, and then a lot of colleagues from academia as well. Now, whilst we principally drive that work with funding support from the Bill and Melinda Gates Foundation, I think that what's important for people to recognize is that it's a government-led and country-owned initiative that is really looking at how it best strengthens capacity for mathematical modeling, which is really applying mathematical concepts or mathematical approaches to quote unquote what we would consider real world problems, so to speak. And so what modeling really does for us is helping us think through all of the ways that there are relationships between different variables that ultimately drive a disease or drive an outcome in health, and how we can potentially think about the different scenarios for intervention that would help us best use those models and those mathematical equations and alignments. Now, what we've particularly looked at is thinking through some of the ways in which the control efforts for climate change exist, or for malaria exist, and how those interventions need to be mixed. Now, in the context of a changing climate, right, and ultimately some of the extreme weather events that will result from a changing climate, we're then faced with needing to think about scenarios that are not particularly typical in the context of what we have now. So if you think through some of the extreme weather events that we anticipate, or some of the changes that we anticipate with a changing climate, you already see that there's a reality where rising temperature, right, would be the order of the day. Now, a change in temperature or rising temperature itself has a very complicated relationship with malaria, in the sense that you need a warm enough temperature for malaria to thrive, but if it gets too hot, then the mosquitoes can't thrive. So it's a really complicated relationship. So what that then means is that countries that are typically cooler are at higher risk of now getting mosquitoes and malaria because of a warmer environment. But countries that are already warm, that might get hotter, might actually have a benefit because of how it affects mosquitoes. But it's a really complicated relationship that is not as linear, as straightforward as that. And then there's also then changing rainfall patterns. So if you think about parts of Nigeria where malaria has a seasonal profile, right? The rains come at a particular time and we see spikes in malaria in those times. At other times when the rains are a bit less, malaria is a lot less in those environments. Now we're seeing that those rainfall patterns are changing, either because the rains are starting later or earlier, or because the intensity of the rains are just a lot higher, right? More rains mean more water that stagnates, more breeding sites for mosquitoes. So the transmission dynamics ultimately get impacted because of that, right? So you're changing climate just in terms of how it affects temperature ultimately through those extreme weather events, or how it affects rainfall, and potentially how it affects humidity as well. Ultimately provide a very different landscape of a direct effect of your climate changing and malaria. And then there are, of course, very clear indirect effects as well, whether in terms of how it would disrupt health systems. Look, if you think about how a flood impacts on your ability to deliver commodities to a health facility, because flood water has cut off the entire community, right?
Yeah.
Or the facility itself is flooded. So there are some of those indirect ways that it would affect health service delivery and those disruptions. There's also just how it would affect behavior. You see, a woman living in a community that has just been displaced from her home because of a flood is really trying to prioritize her sanity and basic conditions of, where to sleep, what food to eat, how to look after her children. See, in that moment, demanding much more routine preventive health services, including looking for her in a mosquito net somewhere, or, if she's pregnant, going for her antenatal, starts to be deprioritized for this person, right? And ultimately, that's not going to help anyone, because those disruptions would then further worsen our disease landscape. So if you think about these really complicated direct and indirect effects that climate change will have on something like malaria, right? And think about how they would affect the mix of control interventions that we have now, with even some laboratory studies showing that with a rising temperature, right, some of the insecticides that we have now will not be as effective, right? So that's a whole changing landscape of things. So we need to start to think from a predictive perspective what those interactions could look like, how they could affect malaria burden in specific subnational geographies, and how those subnational geographies are then positioned to be able to respond to that change. Otherwise, all of the efforts and investment and the leadership that's been provided for malaria elimination now will hit a brick wall, because the changing climate is completely evolving and taking things out of our hands as we move forward. So that's something that we need to think about very carefully, right?
Yeah, I mean, and that's something the Malaria Modeling Fellowship project actually seeks to address, because I mean it's clear that our approach to malaria elimination is changing, right? Or it has to change with the changing climate. And I'm curious, like, did you think about this climate angles as strongly as you did now when you had started the fellowship? And what's your outlook for the future with regards leveraging the modeling capacity to really design the kind of agile interventions we need to address this to address malaria in a changing climate?
Right. So did we think about it to the depths that we have over the last 2 years of that project? Definitely not at the beginning, right? When we started out, yes, climate change was on the horizon as a potential, contributor or something that could potentially shift the landscape, right? And we'd already started to see extreme weather events and how they were directly or indirectly impacting on malaria outcomes as well. But it wasn't really a driver at the beginning, right? But the way we roll out the fellowship, it's a competency-based training for public servants, right, who are already working across the One Health ecosystem. So they're in health, they're in agriculture, they're in the environment. So all of those sectors that ultimately have to come together to be able to respond to any disease context that we have, right? And what we're looking at is building that capacity for them to be able to build models from scratch, not just about them, playing around with existing models or simulating with existing models. But if they have that capacity to build models, they then go back to their primary institutions, and that becomes a competence that is domiciled within that institution as we go forward. Now, that provides an opportunity for them to be able to build models that work routinely, for them to be able to calibrate the existing models with the data that is already being collected in their workspace. And they are then able to think about different intervention mixes, whether for malaria or for other diseases, as part of their routine work, right? So think about all of the colleagues that have experience with managing data for Lassa fever, for cholera, for meningitis. If we empower them with these modeling competencies, they are more likely to be able to apply mathematical models or geospatial models, as the case may be, to their work routinely. So again, that's the aspiration. And we have already seen a few capstone projects that are toying around with some of the components of weather and how they affect transmission dynamics for malaria as is. Now, globally, there are very few models that have been able to try to unpack climate change direct effects on malaria. And it appears to be one of the more complicated issues to study, as the case may be. But again, that's an area that we need to study more, especially from the context of a low middle income country where we know that we would ultimately bear the highest brunt of the effects of climate change, ultimately on malaria and also on some of the other health outcomes as well. So we sort of need to take more leadership of some of these kinds of studies so that we're bringing out nuanced and contextualized findings that are, very easily applicable within our environments. Yeah.
Wow. I'm just thinking about how modeling is, even up until a few years ago, it wasn't really common for me. In fact, I don't even know how common it is for me right now of what modeling is. And I'm just thinking about, we're talking about malaria. Like almost every Nigerian can relate to malaria. Like since I was young, I've had malaria, so many times. And everybody has this, but not everybody can sort of break down this concept of modeling or predicting possible occurrence of malaria. Or the average Nigerian, just like the person I said that tweeted earlier, waiting concern me with climate change. What does climate change have to do with me? They might have gotten comfortable with the concept of just easily treating malaria, especially since they can easily, even without a diagnosis, go buy anti-malaria drugs, right? And they're like, oh, okay, what more can I do, right? This would always come. They can't draw that connection of climate change and malaria. And they feel that, even if it comes, I can easily treat it. It's not as big as a problem as it is to other socioeconomic issues I'm dealing with. I mean, you know how the country is right now. How should they be hopeful? What should they be? What should they anticipate from all of this predictive capacity and the ability to forecast and predict possible malaria occurrence?
Look, I think it's important for people to understand very practically, right?
Yeah.
There are many tools in our toolbox in the fight against malaria. Modeling just happens to be one of the tools in the box. And even in that box where modeling exists, there are many other analytic approaches that ultimately help inform decision-making, right, for malaria and the wider health system. Is that people should understand that the vaccine is just one tool, right? None of them are going to be a magic bullet, ultimately, right? If someone asked you what would be an ideal magic bullet for malaria, what you would tell people is, well, guys, everybody should sleep under a mosquito net, right? That would be your simplistic response to a magic bullet. But realistically, there are no magic bullets. You're going to need to combine a mix of an array of things to ultimately get us to malaria elimination. I think that what I would say to an average everyday person would be, whilst you may think that malaria is not as much of a problem because you figure you can get tested and treated for malaria, you have to think about the economic impact that malaria has on you as an individual and ultimately on the country and the society as a whole, right? Think about the loss of productivity that happens from having malaria, from having days off from work. Think about how all of that sort of sits in. I mean, there are a lot of graphics that show you that Africa's GDP is essentially held back by the malaria burden that the continent has because of how it impacts on people and, on productivity in general, right? And that's not even looking at the context of then you shelling out some of the hard-earned money that you have or resources to actually seek treatment, right? And this landscape is even worse when we think about children or pregnant women who are more likely to suffer extreme outcomes from malaria, right? So I think that for me, the counsel to an everyday person would be malaria is a serious enough issue. Where we can, we should always sleep under a mosquito net because it really ultimately helps. Where we get tested and are being treated for malaria, we should endeavor to adhere to completing our dosing cycle and our medication so that we're not also contributing to resistance that ultimately then hurts everyone as we go forward. I think that's what I would say to an average everyday person. But other than that, from a wider program perspective, all of these tools help, but none of them is going to be a magic bullet for us.
Right. I mean, what I would love to take as much as possible in this conversation, unpack some of those insights, much further. We want to ask you three very targeted questions, right? Sure. Yeah, this is like closing segment, and it's really around myths. There's so many around climate change. Just to ask you, what would be the weirdest myth you've heard around climate change? Like, I mean,
look, I think that the myths abound. Right? The myths, the misinformation, the disinformation abound about climate change. But as a scientist, I think that you always have to circle back to the science.
Yeah.
There is more than enough evidence that is right there in front of all of us of the climate that is changing and of the impact that that changing climate has, right? So I think that it's okay for people to indulge in their conspiracy theories, but I think that as an advocate for science, what we would always recommend to people would be that you have to think long and hard about the impact of the conspiracy theories that you share or advance. Because at the end of the day, whilst these myths may be and continue to be in circulation, there's more than enough evidence from the science to tell us that the climate is changing and that it would have an impact. And that these impacts will be felt by lowest income households and women and children. I think that that's more than enough premise for me to take action. I would not necessarily want to indulge in some of the specifics around the myths or conspiracy theories, because at the end of the day, the science already refutes them. So I think that that's something that we should always center back on.
Absolutely, and the fact that your work centers a lot around women and young children, and that's really crux of what the corona management systems team is doing using data technology, and very commendable. My second question is, if you could institute a universal law to help address the climate crisis, what's one thing? I like how you said about malaria. If there was a silver bullet, if at all there was a silver bullet, it would be for everybody to use mosquito nets.
So is it a universal law and Nigerian law? I need to be sure of which one it is.
I mean, you could give it in whatever context, really. What one thing would you say would be a possible silver bullet, right, to address the climate crisis?
Unfortunately, hard problems require complicated and complex solution mixes, right?
Especially
I don't see a silver bullet.
Especially for one that's almost invisible. So, yeah.
I don't see a silver bullet. I don't see any version where we figure out what one thing can help. Yeah. Right? But I don't think that's really the world that we live in, right? There are people who can say, well, we need to sort of control carbon emissions. It's a difficult conversation to look at a low middle income country that is battling significant levels of poverty and argue against industrialization because they need to reduce carbon emissions, right? That's a very hard conversation to have with anyone, no matter what the context is, right? So when you think about it, if you're having that conversation with people and saying, well, we need you to slow down on industrialization, how are you providing capitalization for that country to then drive the infrastructural growth or close the infrastructural gap that they need to be able to help them make up for the losses from an industrialization agenda? It's a very difficult conversation to have, right? So these are not simple, they're wicked problems that require complicated solutions, that require leadership to ultimately deliver. So is there one universal law I'm going to offer you? Absolutely not. I don't think that there's one that exists. But I think that from my perspective and from a very selfish perspective as a Nigerian, I would like to see stronger country leadership on intersectoral collaboration on the climate journey. I would like to see stronger commitment of resources to building resilience in the health system and at community level for climate events. I think that those are two things that for me I would consider a priority as a Nigerian. If I see stronger country leadership that is focused on intersectoral collaboration, right? There is strong leadership, but how does that leadership help us drive intersectoral collaboration? And I start to see that there's more investment in health systems and community resilience to climate events. That for me would be, quote unquote, my recommended magic bullet for Nigeria. But otherwise, it's a complicated problem that requires real thinking and thought partnership to find solutions.
Basically, the last question actually is, what conversation would you like to hear, right? And who would you want us to invite as the next guest? Right?
That's a trick question.
Yeah.
Well, I mean,
to speak to the issue.
So, practical guy, but also a money guy. I would say very realistically, if I wanted to get one person into a conversation about the climate crisis and what Nigeria needs to be doing, I'd like to talk to somebody with financing capacity and muscle. So whether that's somebody from the Afrexim Bank or from the African Development Bank or from the World Bank or the IFC, as the case may be, but colleagues with access to the kind of resources that the country will need to tap into to help us to mitigate and adapt to climate change. That would be one person, or that would be the persona that I would want to hear from or sort of see in conversations, right? And just in terms of wrapping up statements and just thinking through all of this, I think that we should all come to terms with the fact that climate change is real and that we're already starting to feel the effects in our health and community systems. we need to step up our advocacy efforts to help drive government action in those areas. And from a government perspective, we need to continue to foster intersectoral collaboration and start to think about how we mobilize resources to invest in climate resilient health and community systems. Otherwise, as a low middle income country with a large proportion of poor people, we will end up bearing the brunt of climate events and climate effects. And ultimately, that would be not in our best interest, really, as a country and as a people. And I think that for me, that's really how I would like to end the conversation.
Thank you so much, Chijioke.
Thank you, Emeka.
Thank you so much. This was a wonderful conversation. Shout out to Corona MS and what you guys are doing. They're a proud sponsor of this podcast and the conference, the Future of Health conference this year, our 10th special edition. And here we wrap up the Break It Down podcast, Climate Conversations. Thank you.
Thank you. Have a good day.